for 2024, we have a winner. And the winner for our Societal Impact Award is the DSI NRF Center of Excellence for Biomedical TB Research.
We were quite surprised and also deeply humbled, because when you think of the work that gets done in the infectious disease space, there are so many heroic people that play an important role: the healthcare workers, the nurses, the doctors, the people who work in ICUs, and we play a role in diagnosis. And so to be able to be recognized for that is deeply humbling. It's a great privilege. Our team was quite surprised. We comprised of a diverse group of people that go across the value chain of diagnostics. So we have people who work in the lab, both senior and junior researchers. We recently had a student who joined us who's working in the innovation space for diagnostics. So the core of the award really recognizes the work we've done on delivery of diagnostics for infectious diseases. And it's really around the quality assurance around diagnostics. So often when we think about diagnostics, we imagine a laboratory, some devices, people doing a test, and you think, well, I give a specimen, I get a result. But there's a lot that goes on in the background for patients to be able to A, get their tests, and B, actually have confidence in the result. And so for that, laboratories need to have a lot of quality assurance systems in place to ensure that everything is working. Now, when it comes to infectious diseases, particularly those that get caused by bacteria such as TB that are very easily transmissible through the air, this process of verification becomes quite challenging, right? And so here's the conundrum. If two people go down to a clinic and give a specimen for TB, how do we know that the lab specimens were not mixed at the clinic or when they came to the lab? And when the lab was running the assay, was the diagnostic device working properly? And when the result came out, was the right result given to the right patient, right? So in order for us to know all those things are working, those diagnostic labs have to have proficiency testing systems in place. And the way they do that is you take a known number of TB bacteria and you put it onto a specimen, you push it through the lab flow, and if you get the right result at the end, you say, well, this lab is functioning. The problem with TB bacteria is they're dangerous. You can't send them to labs. We're going to make people sick. And so this is the problem we were presented with. Roughly in 2010, South Africa was going to be one of the first countries to roll out molecular diagnostics for TB. This is a diagnostic that's based on looking for the DNA of TB bacteria. Before this, we were culturing the bacteria. It was taking really long. It was horrible in terms of the healthcare system. And we were not giving the patients the best they deserve, right? So these new tests would allow people to access diagnostics faster, and more importantly, it would allow them to get onto treatment faster. But the hiccup was, how do we know the diagnostics work, right? And so we were approached through the NHLS and the National Priority Program to say, can you assist with this problem? And so we came out with a series of products which comprised dead TB bacteria. We just figured out a way of growing them, killing them so they remain whole, and then they were placed on a little piece of filter paper. They created a little spot, and these spots were sent out around to labs, and labs could use them to verify that the diagnostic devices work. So that was our first generation technology. And then one of the problems we had with TB bacteria is they took very long to grow. You know, it takes about a month to grow a culture. Then we have to kill the bacteria to make sure they're safe, and we have to wait for about 2 months. So the whole process was taking 3 months. And so someone approached us. They were in a rush. They needed to get their program going for TB diagnosis, and we told them, wait 3 months. So that was the wrong answer. And so to get around this problem, we said, well, these devices don't really care whether the bacteria are TB or not. They're just looking for that piece of DNA. So we took a bacterium that lives in the sand, completely safe, harmless, not dangerous, but it looks very much like the TB bacteria. If you look at it under the microscope, it's got the same shape, it's got roughly the same kind of a wall. And we took this little piece of DNA that these TB diagnostic devices look for, and we engineered it into the soil bug. And suddenly the soil bug was read as TB. We call it biomimicry. The bug was mimicking TB, but it was safe, it wasn't dangerous, it was easy to grow. Within a few days, you had a batch that you could send out. And so very quickly, we went from an incredibly big and debilitating choke point in diagnostic care to being able to roll out this thing to all labs in South Africa. And eventually, after getting CDC and WHO approval, we were supporting around 50 countries around the world, with their TB diagnostics. And that was great. And what was nice about this biomimicry technology is we were able to pivot it for COVID. So when South Africa hit this massive barrier of rolling out mass testing, we developed, using the same technology, we developed the world's first biologically safe coronavirus biomimetic, at least to the best of our knowledge. And we were able to use this to get our health system unstuck, to get mass testing going, but we helped roughly 34 countries to roll out mass testing. So that's what we were able to achieve. We've developed almost 20-odd different series of products. So you take the same platform and we're able to generate an HIV control, we're able to generate a control for methicillin-resistant Staph aureus, we are starting to do something for monkeypox now. We also have a control for a variety of different types of cancers. So we started with a leukemia cell line and we're building other cancer cell lines. So it's wonderful to be able to take this technology and push it to its boundaries so that you can create more products that benefit the health system. It's incredible. Like, we have this little lab in Braamfontein on the top of Constitution Hill, and from there you create products that go out all over the world. WITS does this. WITS reaches out, all over the world and creates meaning and impact, which is quite wonderful when you think about it. So it's gratifying to be recognized, especially in the context of the last 3 or 4 years. I remember those days during COVID when we were coming to the lab at all hours of the day and night. We were sometimes sleeping in the lab, and it was really a very gargantuan effort to be able to generate control so that we could start mass testing here. There was a lot of personal sacrifice on behalf of the team members. Many of them had little time with their families during what was a very troubling time for the world. But they sort of left their families at home, they came to the lab and they poured themselves into this work, and it's wonderful to see that that effort has been recognized. It's also given us a big boost to innovate more. As an example, we've come up with a new TB vaccine. This has been developed in our lab, and it looks like it's working better than the current vaccine. So it's really given us a big boost in terms of our innovation portfolio, which has been quite nice.